My name is Michael Wood. I'm the Director of Cardiovascular Perfusionist at Memorial Hospital, and my job is to basically supervise and oversee the provision of cardiovascular perfusion, which is extracorporeal technology, which simply means to perfuse or take blood out of the body, put it through a device, and return it back to the body in a normal fashion to sustain life. So it's an administrative job as well as a clinical job. In order for the surgeon to do what is commonly called bypass surgery, which is to take a conduit or a tube, which in this case is a vessel from the leg, and run it from the biggest vessel in the body, the aorta, to a point on the heart that has disease past it, so that blood goes from the aorta past the disease to a normal spot on the heart. We have to take the blood out of the heart, making it bloodless. So essentially the heart collapses and he has a dry field to work on. We take the blood from the body and shunt it to our devices, and we oxygenate it, and then we blow off the carbon dioxide, and then we put it under pressure and put it back into the body. We're multifocal or multidiscipline in the sense that we work to support the cardiac cath lab with balloons that go into the body to help pump with the heart to keep the patient stable while they do cardiac procedures to look for the disease. We salvage blood in multi-discipline ORs, orthopedics, trauma, general surgery, OB-GYN, to where we take the patient's shed blood, we collect it, we filter it, we wash it, we process it, and we put it back into a bag. That bag is then handed back to the anesthesiologist, and at that point he reinfuses it into the patient again. So we prevent you from losing your blood, having to use blood from the blood bank. So those are other things that we do. Well, I had 27 years experience with the military. My background is EMT, paramedic, field medic, respiratory therapist, physician's assistant, mechanized infantry, armor. Then I went into cardiothoracic surgery, emergency medicine, and then I went into cardiovascular perfusion. So I brought all of that 27 years experience with me. The things that I've learned here is the excitement and intrigue of a multi-center unit, 3 hospitals that kind of orbit around one another and make up CAMC. And each supports the other, and each has its own special flavor as far as what it takes to administratively work between the 3 units. We do roughly 1,700 open hearts a year in one building. And it's really a challenge to take that work load, the number of patients, and then channel them through the facilities that we have in a very, very efficient manner. But a lot of people work very hard to make sure that gets done. It's a lot of teamwork. A pretty awesome affair when you consider that we're running 1,800, 1,900 cardiac procedures through our cath lab. We're running 1,700 open hearts through our operating rooms. The operating rooms are still providing general surgery, trauma, any type of care that needs to be done or needs to be provided to the community. And we bring in everyone from the admissions clerk, assistant administrators, the vice presidents, the directors of all the individual departments, the operating room, x-ray, the laboratory, cardiovascular perfusion, epidemiology, nursing services, nursing education. It takes everything to blend this melting pot of required skills, required our clinical performance and provision of care, sustaining education, continuing education, meeting the Joint Commission standards. It is just the melting pot of all these talents, of all these people who are being interviewed today probably or this week, being put into a pot and then expected to come out of the end with a product. And our product is very good. People on bypass to do ECMO, which is an artificial lung. We do cell salvaging here all the time for routine cases and for trauma cases. Essentially anything we do at Memorial, we can do at General. We are well prepared. We have a great system in place to be able to do that and do it quickly. We have a 30-minute response to any call for any care at any of the hospitals. So I have staff that basically works 24 hours a day, 7 days a week. I have a calls tier system that basically involves up to 8 people per day being on call. in a rotating fashion. As we need one person, we go to the next, and we go to the next, and we go to the next, and we go to the next. And sometimes we run through the entire inventory. Just depends on what's going on in what particular institution. I've done a lot of jobs, and what I like particularly about perfusion is that the requirement for attention to detail in the acts that we actually go through to conduct the cases, I akin it to basically flying the space shuttle. We have checklists that we observe before we go on bypass. We have checklists and requirements that we observe while we're on bypass. Our communication is absolute and clearly stated to the surgeon, and his is likewise to us, in order to accomplish the events of the case. And there's probably 150, 170 pieces of equipment we have to look at, inspect, and check each case. There's probably 200 or 300, 400 events that go on with the case, depending on how the length of the case is and the degree of complexity, that we have to communicate with the anesthesiologist and the surgeon and the nurses in the room in order to accomplish what we do. So in that case, essentially it's just the epitome of a team working together to accomplish a common goal. And I think there's a lot of reward in that. Plus, we actually help people's lives to be longer, fuller, without pain, and they have the ability to return to a lifestyle that hopefully allows them to go back to what they like to do. A lot of our patients are elderly, and we give them back their cardiac output, their heart function to a point where they don't have pain, and they can go work in their gardens, be a part of the community, and do those things that we'd like to be able to do, to the point where we're no longer able. So we have a lot of people that we extend their ability to enjoy their life. Education was concerned. The United States military has provided me essentially 2 baccalaureates, with the only requirement on my side is that I passed the course, and I held up my hand and volunteered to go. And I can say that probably in my career I was probably in school half of it. And the rest of it was pretty rewarding in every job I did. Every job I did, I grew or advanced or gained more knowledge, and that made me more hungry to take on further challenges. And we don't know what's going to come next. So the field is still, I think, one which is challenging and going to be around for a long time. There's specific centers that do nothing but ECMO, or the artificial lungs. There's centers that do nothing but pediatrics. For the valvular surgeries and structural defects in the heart, bypass surgery still is what is on the main menu. Now we're looking at doing robotics at Memorial, and that may change some of the processes that we go through right now.